1. A patient taking warfarin has an INR of 5.2. What is the priority nursing intervention? Answer. Hold the warfarin dose and prepare to administer vitamin K as prescribed. Rationale. An INR above 5 increases the risk of severe bleeding. Holding the dose and administering vitamin K helps reverse warfarin's effects. 2. A patient receiving a loop diuretic reports muscle weakness and irregular heartbeats. What is the nurse's priority action? Answer. Assess serum potassium levels and notify the healthcare provider. Rationale. Loop diuretics, e.g. furosemide, can cause hypokalemia, leading to arrhythmias and muscle weakness. Early intervention prevents complications. 3. A patient taking digoxin reports nausea, vomiting, and blurred vision. What should the nurse do first? Answer. Check the patient's apical pulse and digoxin level. Rationale. These symptoms indicate digoxin toxicity, which requires monitoring the pulse and drug level before further intervention. 4. A patient prescribed lithium has a serum level of 2.1 milliequivalents per liter. What is the priority intervention? Answer. Hold the lithium dose and initiate supportive care for toxicity. Rationale. A lithium level above 1.5 milliequivalents per liter suggests toxicity, which can cause severe neurological and cardiovascular symptoms. 5. A patient on atorvastatin reports muscle pain and dark-colored urine. What should the nurse do? Answer. Notify the healthcare provider immediately. Rationale. These symptoms indicate rhabdomyolysis, a serious adverse effect of statins that can lead to acute kidney injury. 6. A patient prescribed an MAOI asks about dietary restrictions. What foods should be avoided? Answer. Aged cheeses, cured meats, and fermented products. Rationale. These foods contain tyramine, which can trigger a hypertensive crisis when combined with MAOIs. 7. A patient receiving IV vancomycin develops flushing and hypotension. What should the nurse do? Answer. Slow the infusion rate and monitor the patient. Rationale. Rapid vancomycin infusion can cause red man syndrome, a histamine reaction managed by slowing the infusion. 8. A nurse is administering metoprolol to a patient with a blood pressure of 88/50 millimeters of mercury and a heart rate of 52 beats per minute. What should be done first? Answer. Hold the medication and notify the healthcare provider. Rationale. Beta blockers lower blood pressure and heart rate, and in this case, administration could worsen bradycardia and hypotension. 9. A patient on heparin therapy has a PTT of 95 seconds. What action should the nurse take? Answer. Stop the infusion and prepare to administer protamine sulfate. Rationale. A PTT above therapeutic range increases bleeding risk. Protamine sulfate reverses heparin's effects. 10. A patient taking spironolactone is experiencing muscle weakness and palpitations. What is the priority action? Answer. Assess serum potassium levels. Rationale. Spironolactone is a potassium-sparing diuretic that can cause hyperkalemia, leading to cardiac complications. 11th. A patient taking prednisone reports weight gain and moon face. What should the nurse explain? Answer. These are common side effects of long-term corticosteroid use. Rationale. Prednisone can cause Cushingoid features due to fluid retention and fat redistribution. 12th. A patient prescribed nitroglycerin for angina experiences dizziness and a headache. What should the nurse advise? Answer. Sit down and take the medication as prescribed. Rationale. Nitroglycerin lowers blood pressure, causing dizziness and headaches, which are expected side effects. 13. A nurse is preparing to administer morphine to a patient with a respiratory rate of 8 breaths per minute. What should be done? Answer. Hold the dose and notify the provider. Rationale. Opioids depress respiratory function, and administration in this case may lead to respiratory failure. 14. A patient taking levothyroxine reports palpitations and weight loss. What should the nurse do? Answer. Check the patient's TSH and T4 levels. Rationale: these symptoms suggest overmedication, leading to hyperthyroidism. Monitoring thyroid levels is necessary. 15th, a patient on methotrexate for rheumatoid arthritis has a WBC count of 2,500 per cubic millimeter. What is the priority action? Answer: hold the medication and notify the provider. Rationale: methotrexate suppresses bone marrow, increasing infection risk when WBC count is low. 16. A patient receiving metformin reports difficulty breathing and confusion. What should the nurse assess for? Answer: lactic acidosis. Rationale: metformin can cause lactic acidosis, especially in renal impairment, leading to severe metabolic complications. 17th, a patient on clozapine has a fever and sore throat. What is the nurse's priority intervention? Answer: assess the WBC count immediately. Rationale: clozapine can cause agranulocytosis, increasing the risk of severe infections. 18. A patient receiving phenytoin develops ataxia and slurred speech. What is the most appropriate nursing action? Answer: check the patient's serum phenytoin level. Rationale: these symptoms indicate phenytoin toxicity, requiring monitoring of drug levels. 19. A patient receiving isoniazid reports numbness and tingling in the extremities. What should the nurse recommend? Answer: take vitamin B6, pyridoxine supplementation. Rationale: isoniazid can cause peripheral neuropathy, which is prevented by vitamin B6 supplementation. 20. A patient on fluoxetine reports increased suicidal thoughts. What is the priority nursing action? Answer: assess the severity of suicidal ideation and notify the healthcare provider. Rationale: SSRIs can increase suicidal thoughts, particularly in young adults, requiring immediate assessment and intervention. 21st, a patient receiving IV potassium chloride reports burning at the IV site. What should the nurse do? Answer: slow the infusion rate and assess the IV site for infiltration. Rationale: IV potassium chloride is highly irritating to veins. Slowing the infusion and assessing the site can prevent extravasation and tissue damage. 22nd, a patient taking amiodarone develops a dry cough and dyspnea. What should the nurse do? Answer: notify the healthcare provider immediately. Rationale: amiodarone can cause pulmonary toxicity, which may lead to life-threatening fibrosis if not addressed early. 23rd, a patient on hydrochlorothiazide reports dizziness when standing. What should the nurse teach? Answer: change positions slowly and increase fluid intake. Rationale: thiazide diuretics can cause orthostatic hypotension and dehydration, which can be managed by slow position changes and hydration. 24. A patient taking carbamazepine reports fever and a sore throat. What is the priority nursing intervention? Answer: check the patient's CBC for signs of agranulocytosis. Rationale: carbamazepine can cause bone marrow suppression, leading to agranulocytosis, which increases the risk of severe infections. 25th, a patient receiving IV furosemide develops ringing in the ears. What should the nurse do first? Answer: stop the infusion and notify the provider. Rationale: high-dose or rapid IV furosemide can cause ototoxicity, which may be irreversible if not addressed promptly. 26. A patient taking haloperidol exhibits a high fever, muscle rigidity, and altered mental status. What is the priority action? Answer: discontinue the medication and initiate supportive care for neuroleptic malignant syndrome. Rationale: neuroleptic malignant syndrome, NMS, is a life-threatening reaction to antipsychotics requiring immediate intervention. 27. A patient taking methyl-dopa for hypertension reports dark urine and jaundice. What should the nurse suspect? Answer: hemolytic anemia or liver dysfunction. Rationale: methyl-dopa can cause hemolysis and hepatotoxicity, requiring immediate evaluation. 28th, a patient prescribed colchicine for gout reports severe diarrhea and abdominal pain. What is the appropriate nursing intervention? Answer: hold the medication and notify the provider. Rationale: colchicine toxicity can cause severe gastrointestinal distress and bone marrow suppression, requiring dose adjustment or discontinuation. 29th, a patient on propranolol for migraine prevention reports wheezing and shortness of breath. What is the nurse's priority action? Answer: hold the medication and assess for a history of asthma. Rationale: non-selective beta blockers, like propranolol, can cause bronchospasm, especially in patients with respiratory conditions. 30. A patient taking rifampin for tuberculosis notices orange discoloration of urine and tears. What should the nurse explain? Answer: this is a harmless side effect of rifampin. Rationale: rifampin commonly causes harmless orange-red discoloration of body fluids, which does not require intervention. 31st, a patient on clopidogrel before surgery asks if they should take today's dose. What should the nurse advise? Answer: hold the medication and confirm with the healthcare provider. Rationale: clopidogrel increases bleeding risk and is usually stopped before surgery to prevent excessive bleeding. 32nd, a patient taking disulfiram for alcohol dependence consumes alcohol and experiences nausea, palpitations, and sweating. What is the priority intervention? Answer: provide supportive care and monitor vital signs. Rationale: disulfiram causes an aversive reaction when alcohol is ingested, requiring symptomatic management. 33rd, a patient taking tamoxifen for breast cancer reports heavy menstrual bleeding. What should the nurse do? Answer: notify the provider about potential endometrial hyperplasia. Rationale: tamoxifen increases the risk of endometrial cancer, requiring evaluation of abnormal bleeding. 34th, a patient on albuterol nebulizer treatments reports tremors and palpitations. What should the nurse do? Answer: reassure the patient that these are expected side effects. Rationale: beta agonists like albuterol can cause temporary tremors and tachycardia, which usually resolve on their own. 35. A patient receiving doxorubicin for chemotherapy develops shortness of breath and ankle swelling. What is the priority action? Answer: assess for signs of heart failure. Rationale: doxorubicin can cause cardiotoxicity, leading to heart failure, which must be monitored. 36. A patient on phenytoin for seizures has swollen, bleeding gums. What should the nurse recommend? Answer: practice good oral hygiene and schedule regular dental visits. Rationale: phenytoin can cause gingival hyperplasia, which can be managed with proper oral care. 37. A patient taking sildenafil for erectile dysfunction reports chest pain and plans to take nitroglycerin. What is the nurse's priority action? Answer: instruct the patient not to take nitroglycerin and seek medical attention. Rationale: the combination of sildenafil and nitrates can cause severe hypotension, which can be life-threatening. 38. A patient taking valproic acid reports unusual bruising and prolonged bleeding. What is the priority nursing action? Answer: assess liver function tests and platelet count. Rationale: valproic acid can cause thrombocytopenia and hepatotoxicity, increasing the risk of bleeding. 39th. A patient taking escitalopram for depression reports excessive sweating, confusion, and muscle rigidity. What is the nurse's priority action? Answer: assess for serotonin syndrome and notify the provider immediately. Rationale: escitalopram is an SSRI that can cause serotonin syndrome, a potentially fatal condition requiring urgent intervention. 40. A patient on acetazolamide for glaucoma reports tingling in the fingers and toes. What should the nurse explain? Answer: this is a common side effect due to metabolic acidosis. Rationale: acetazolamide can cause paresthesia due to changes in acid-base balance, which is usually benign.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!